Thank you, Mr. Chair. I'm very pleased to be able to participate in this important debate today on household overcrowding and the COVID-19 outbreak, and I thank the member for East Ham for bringing this debate forward. As we've heard, there is no doubt that the link between housing and health outcomes are inextricably linked, and those living in poor housing are more likely to suffer from poor mental and/or physical health. COVID-19 has indeed thrown into stark relief the existing and ongoing housing challenges which need to be addressed. It seems self-evident that household overcrowding is associated with greater risk of transmission of the virus, as self-isolation, as we've heard, becomes much more difficult, as does shielding. And this may well have contributed to a higher death rate. Analysis carried out by Inside Housing shows a clear correlation between overcrowding and COVID death rates. In addition, as lockdown forces us to spend much more time at home, doing so is much more challenging for those living in these overcrowded conditions, with one study showing that nearly 20% of those in overcrowded conditions during lockdown have experienced mental or physical health problems due to a lack of space. But going back to the example of overcrowding given by the member for East Ham in his constituency, I know all too well what that is like in normal times, because growing up as I did in a small 3-apartment flat with I and my 7 older siblings, with my mother and my stepfather, as my mother waited an astonishing 28 years for the council to allocate her suitable accommodation, which it finally did in 1982 on my 14th birthday. I hope the member for East Ham's constituents don't have to wait quite as long as my family did for suitable accommodation, because I know the damage caused by living one on top of the other with no space, no privacy in such overcrowded conditions. But even I cannot imagine how people can possibly cope well with such overcrowding during lockdown, and how much more challenging lockdown have made such terrible living conditions. We cannot change the past, but the focus now must be to ensure more affordable homes are built. In Scotland, the SNP government has built 97,000 affordable homes since 2007. In the 4 years to 2020, the SNP government in Scotland has delivered over 75% more affordable homes per head of the population than in both England and Wales. The Scottish Government has recognised the positive social and economic impact that investment in social housing brings, and remains committed to expanding the social housing stock. In Scotland, the £30 million Rural and Islands Housing Funds support the delivery of affordable homes, and that is to be continued beyond March 2021, with the Affordable Housing Supply Programme having already delivered 5,000 affordable homes in rural and island areas in its first 4 years. But there is still more to do. In its report on building more social housing, the Housing, Communities and Local Government Committee recommended that a social house building programme should be top of the UK government's agenda to rebuild from the impact of COVID-19. The report went on to say that the crisis has exposed our broken housing system. Families in overcrowded homes have faced worse health outcomes. What the government needs to do in the first instance is to help those living in overcrowded accommodation. Investing in more social housing is an obvious way to do that, but it's also vital to reverse effective cuts in local housing rates, and scrap poverty-inducing policies such as the hated bedroom tax, which the Scottish Government has completely mitigated in Scotland. The decision to maintain local authority housing rates in cash terms in 2021-22 actually represents a freeze for private renters, and puts all the work done by the Scottish Government to support homeless people at risk, and potentially makes private sector tenancies unsustainable for some. Indeed, there are examples where the temporary restoration of local housing rates has facilitated moves out of temporary accommodation. The freeze in local housing rates for a government which wants to be taken seriously on tackling homelessness was not considered in last week's budget. Meanwhile, the Scottish Government has an estimated spend on the Discretionary Housing Payment for 2021-22 of £82 million, and is an important tool used by councils to safeguard tenancies and prevent homelessness. And £71 million of that money is used to mitigate the bedroom tax for over 70,000 households in Scotland to help them sustain their tenancies, with another £11 million spent on mitigating other cruel welfare cuts, such as changes to local housing allowance rates. And the policy of no recourse to public funds means that long before the pandemic hit, this policy was pushing working families into abject poverty, forcing them into unsustainable debt and into homelessness or unsafe, overcrowded and insecure housing. Indeed, the Children's Society highlighted last year that those families with no recourse to public funds, leaving them without access to housing benefit or social housing, it becomes immensely difficult for these families to proper shelter their children. This matters because COVID-19 is no respecter of immigration status, and everyone needs help to get through and survive this crisis. Now, the Scottish Government can't change these policies because 85% of welfare expenditure and income replaced benefits remain reserved to Westminster. All the Scottish Government can do is try to mitigate the very worst impacts of these policies, bearing in mind the Scottish Government is required to present a balanced budget every single year, which means the huge sums of money spent trying to protect Scots from regressive policies of this government means less money can be spent on other areas, and I hope the Minister will reflect on that. So what we know is that there are real housing challenges across the UK. The Scottish Government has a demonstrable record of trying to tackle that. The UK Government, not so much. But COVID has thrown these challenges into stark relief, and the Minister knows that the solutions here are it's not brain surgery. We know what needs to be done to tackle overcrowding, which there's little doubt was directly linked to people catching and dying COVID in this pandemic. So this government, I urge the Minister to be more ambitious about plans for building social housing, and not just through announcements, but actual building. The government also needs to abandon its effective freeze on local housing allowance to facilitate more secure tenancies and help more people move from temporary to more settled and suitable accommodation, which we have seen it can do. In addition, the UK government needs to abandon its bedroom tax, which effectively prices people out of their homes, and it also needs to look afresh at the inhumane policy of no recourse to public funds and the real damage that has done and continues to inflict on families, not just during the pandemic, but this has certainly shown in clear vision what that has meant during the pandemic. Now, we have suffered a global health pandemic, and it's not over, but we can already start to learn the lessons of how we can do better to tackle deep-rooted and long-standing housing challenges such as overcrowding and poor living conditions, which have a genuine impact on the mental and physical health of too many people. The word home indeed should conjure up images of safety and warmth, a place you want to be. For too many families, poor overcrowded conditions mean that this is simply not the case for them. We know what the challenges are, and we know what measures are needed to tackle and mitigate these challenges. And I hope the Minister today will tell us how he and his government intend to just get on and get down to this important work.